A first-time patellar dislocation can be painful for a young athlete and keep them away from the sport they love. Dislocations most often occur in adolescence, with a female predominance. In addition, recurrent dislocations can cause serious cartilage damage, which can be debilitating for individuals who are far too young to have a joint replacement. Following a first-time dislocation, the soft tissue sleeve making up the medial patellofemoral complex, or MPFC, which includes the medial patellofemoral ligament, MPFL, is injured in 99% of patients. Historically, it was thought that first-time dislocators had a low risk of recurrence. However, it turns out that individuals with a combination of several identifiable risk factors have a 70% chance or greater incidence of recurrent dislocation. There are both bony and soft tissue risk factors that predispose patients to recurrent dislocations. The most predictive risk factor is trochlear dysplasia, in which the normal deep V of the trochlea groove is either flat or replaced by a bump. Patella alta, or high-riding patella, is another risk factor for dislocation, where the patella is not safely engaged in the trochlear groove until deep flexion. Finally, an elevated tibial tubercle to trochlear groove, TT to TG distance, creates a lateralized force vector that also predisposes to recurrent dislocations. In the first-time dislocator, without loose body or osteochondral fracture, the current standard of care is non-operative treatment. In the future, risk stratification may identify high-risk patients with an unacceptable recurrence rate who may benefit from consideration for early soft tissue stabilization surgery. However, surgery is clearly recommended in young individuals that have knocked off a piece of bone or cartilage. In these cases, when possible, the osteochondral fracture should be surgically repaired. And if there's a large fragment that cannot be repaired, the goal is to remove the piece and consider cartilage restoration for large deficits. When surgery is mandated in a first-time dislocator due to an osteochondral fragment, surgical treatment should also include a stabilization procedure to treat the underlying instability. Otherwise, these patients are left at high risk for another dislocation and further cartilage damage. Rarely, primary MPFL repair may be considered in patients with normal bony anatomy and an isolated injury with good tissue quality that can be easily identified. However, in most cases, medial-sided ligament reconstruction is preferred and leads to a significant reduction in the risk of recurrence, as well as improved outcome scores in both adult and pediatric patient populations. Therefore, the goal in treating the first-time patellar dislocator involves a careful evaluation of concomitant cartilage injury and risk assessment in order to restore patellar stability and the articular surface. Ideally, this will result in improved functional outcomes as well as long-term joint health.